Greetings, PsychU community, and welcome to today's webinar, For Better or Worse, Bridging the Care Continuum for Mental Health Services in Our New Reality. And along those lines, I'm actually going to go over to Tony now, who also has done quite a bit of work in this area as your role as a nurse practitioner. And I know you've conducted some interviews for us as well, talking about some of the mindfulness exercises and some of the breathing techniques that you incorporate for your staff. Could you share a little bit more on that?
Yeah, but I want to begin with an important observation, and to me, it's an important observation. By the way, for those of you out there in PsychU land, my name is actually Alan Tony. It reads Alan on your screen. They're both my name. People in my family call me both. I answer to both. Don't worry. So I think one of the things that I really can't let go by is there are 4 of us on the screen here: a social worker, somebody representing peer support, a medical doctor, a psychiatrist, and me, who's a nurse practitioner, but also I'm one of the past presidents of the Illinois chapter for psychiatric nursing. So here we are, all 4 of us together, and in an ideal world, we would always be together. In an ideal agency, in an ideal clinical setting, patients who have needs, people who have needs, would be hearing from all of us. And the problem is right now there's not enough of any of us, and we're really in a fragmented situation. So when we talk about the continuum, we have to note that there are spots out there where there is a continuum, and then a lot of fragmentation. And I think really one of the things that has to be a message that comes out of this is that all of us have to keep striving to push forward for continua to exist. Because right now, people come to me in my office where I see outpatients in the community, and I hope that I can find them a therapist. And then talking to their primary care provider is a whole nother problem. And then finding them and finding them and finding them and finding them. So what do? So I love being a nurse practitioner. Psychiatry is a fast growing area of interest for nurse practitioners. And it's a great career. We have such huge needs out there, and there is no question that we need more and more physicians to help do what we're doing. And G's going to tell you about some steps that have been taken to improve that pipeline. But then you have us as well, and we can help support in those areas where it's appropriate and within our scope of practice to be seeing patients. There are huge gaps in perinatal psychiatry. I mean, we have only a few people in Chicago whose specialty is taking care of the women before, during, and after pregnancy. And last time I checked, more women than men got depressed, and more women, coincidentally, also got pregnant. But we don't have enough people to take care of those women. We are desperately short of geropsych. We are desperately short in child psych. So these are all areas where nurse practitioners are starting to work both with physicians, and now Illinois is a full practice state. There are states where that is possible. Again, where it's appropriate, where it's within our scope of practice to be seeing a patient, to start to help fill in those gaps. Nursing, I think, is a different story. Psychiatric nursing, I think, is a super valuable part of the continuum. And unfortunately, it's shrunk down pretty much to just inpatient, which is great. We need inpatient psych nurses. They're the ones who are working with the patients every day. But there are nurses are being moved further and further into the role of simply the person who passes the meds and does the admissions and discharges. And we are vanishing from the outpatient settings. It's too expensive, people say. That's what they tell us. But the problem is, in that case, then you don't have really skilled people who are calling the patients, finding out if they got the meds, triaging for side effects, knowing what's important and what isn't, doing appropriate med education. And so those tasks then fall back on the higher level providers, the nurse practitioners, the physicians. And so I think there's a real gap that has opened up here in that. in terms of the roles of psychiatric nursing, because psychiatric nurses, making sure that patients have meds, making sure they understand them, that they're taking them correctly, in some cases visiting them and helping set up pill boxes. We know from ACT team settings, it works. We just don't have nearly enough of it.
Wow. So I think that a lot of our members, if they don't already have a degree in one of these areas, they're probably trying to download their online applications now, see if they can sign up and get into nursing school or medical school. Jonathan, what are your thoughts about the social workers and the need for those? Do we need to have people filling out applications for social work as well?
So I have a bunch of thoughts about this. Let me try and share them with a little story. When I was doing some research about 8 years ago at in Philadelphia, I was looking at parents who brought their kids in to the emergency department to get their kids evaluated for suicide risk, and I I was asking them how and why they showed up there at that time. And then I followed up with them 3 to 6 months after discharge to look at post-discharge follow-up care, things like that. There were two interesting findings from the study. One of them was that their faith was central in their journey. And the second part was that these parents of suicidal kids just wanted to talk with other parents of suicidal kids. They wanted the peer support. They, some of them were happy to have the appointment with the psychiatrist or the nurse practitioner to talk about medication. Some of them were fine having somebody come to the house and do family therapy. But and on the psychiatry side, there definitely were gaps, right? You were looking at, even for kids in crisis, a couple of weeks at best to get an appointment, and sometimes 3 to 6 months to see somebody. And that's on the far end, but and there were plenty of social workers who could show up. But what they needed, and this gets to Tony's point about the gaps or the fragmentation in the continuum, we might have plenty of people signing up for social work programs and nurse practitioner programs, and there's certainly a need, but what is it that people out there who have family members that are struggling, what do they actually need? What do they want? And I think this is one of the ways in which the professionalization of mental health services has been challenging, because these parents just wanted to talk with other parents. And so let's fast forward to the pandemic and the fact that everything's gone online. One of the things that I tried to do, as sort of taking the implications of these research findings and turning them into practice, is that I tried to develop an online community of parents of kids who were suicidal or who had been suicidal. Because really the problem is you've got a suicidal kid, crisis is over, you just need to get back to work. You want to go back to going out to dinner. You want to make sure, you want the kid is sleeping in their own room. You're not, you can finally, like, you're not necessarily hanging a shingle out as a parent saying, hey, and now come talk to me, right? I want to relive this. I want to talk about this. And so how do we get access to those parents? And so I tried creating this online community, not just by myself, but I partnered with folks. And it was really difficult, in part because people didn't see the value of providing services online, because our system is set up for in-person. So the pandemic happens, everybody moves online, and it was just unfortunate timing because the program that I was involved in, it was an app. It went out of business this past September, right? So we didn't quite make it to the pandemic, to when online services were all the rage. But I think that this question of having peer support, having professional support, and then what we've learned from the pandemic about how you can provide valuable support online. I think all of these things are things that um, we need to make sure we don't lose, because there's so many people that need to have other folks in their lives, and having online support is absolutely the way, whether we have to wear a face mask or not, out in the real world, to get the things that people need to be able to support their kids, their loved ones, and themselves.